Next up, I also want to touch on the different extracurricular activities that you might want to get involved with as a pre-med student. I think this part of the video is definitely a lot more from my own experience because you're really able to do a bunch of different things as a pre-med and sort of package all that together into what kind of makes you unique, right? So what I'm going to be talking about and some of the recommendations that I make, I think are just suggestions, but definitely I think the priority when it comes to your extracurriculars is really just investing in what you're interested in and what you're really passionate about and really willing to actually apply yourself deeply to. Another way to think about this is what the American Association of Medical Colleges calls their core competencies. So essentially, the core competencies you can actually Google is just a list of different skills that medical schools are looking for in an applicant, but those skills aren't tied to specifically one extracurricular versus another. So for example, one of the core competencies would be demonstrating leadership, but you can demonstrate leadership in a job where you're training other new hires or as the leader of some organization or in some other capacity entirely. So I think really when it comes to extracurriculars, I wouldn't stress too much about what it is specifically that you're doing, so much as just that you're able to really put yourself into the activity and really get a lot out of it. So that being said, I do want to touch on what feels like two of the big broad areas that are important to demonstrate that you have some experience with as a pre-med. And those two areas are research as well as volunteering. To start with talking about research, I think that Brown is a really great school for getting involved with research. Our undergraduate student population is around 6,000 and our graduate student population is around 3,000. So the ability to really get into a lab and work with research mentors is not super hard because you're not competing with a giant graduate student population, which I think is really important. I know for me, I didn't do any research before I came to college, and I was able to get involved in a cognitive neuroscience lab in my first year at Brown just by reaching out to professors and emailing them and essentially saying, hi, I'm really interested in the research that you're doing. Would you be willing to take on an undergraduate as a trainee in your lab? And one of the professors that I emailed said yes, and that was how I landed my first research position and how I gained a lot of experience learning about how research works. So when it comes to being pre-med and doing research, I think something that I really want to emphasize is that you don't have to be doing wet lab, cellular-based research, which was my preconception of what doing research related to medicine would look like. You definitely can also do that, and there are a lot of opportunities for students to get involved with that here at Brown, but I do just want to put out there that if you're interested in doing some other kind of research instead, that also definitely works. The important part of research is really just demonstrating that you're able to think critically about a problem and design some way to study that problem, as well as address the different confounds that can come up and look at your data and draw a relevant and not overly broad or overly specific conclusion from it. As far as volunteer work goes, I've also found that Brown is a really accessible setting for getting involved with different organizations that will be able to give you some clinical experience. There are a bunch of different clubs at Brown that all kind of center around some kind of healthcare or health advocacy participation. So for me, I'm involved in a club called Connect for Health. That's public health advocacy work where we work directly with patients at local hospitals to connect them with resources that they might need in order to help with their overall health and their recovery from their specific medical conditions. So things like helping them find the nearest food pantry or helping them to apply for discounted utilities are things that we do as Connect for Health advocates. I know I found that volunteering in the hospital in Providence, which is where Brown is located, is pretty easy. There's of course some paperwork and vaccinations that you have to do, but otherwise I found that anyone who wants to volunteer at the hospital, as long as their schedule kind of works out with theirs, is able to get involved, which is also really nice. Another aspect of sort of volunteer work or just gaining general clinical experience that's important to think about as a pre-med is shadowing. So shadowing is essentially just following a physician around and kind of seeing what their work is like and what they do, how they interact with patients, what working in their specific specialty looks like. And I found that Brown is a really great place to find those shadowing opportunities just because Providence and Rhode Island in general is not super big. And so as a result, a lot of the doctors who work in the local hospitals are also affiliated with Brown as faculty members. And so as a result, it's pretty straightforward to reach out to these faculty members and ask if they're willing to let a student come in and shadow. So for example, I actually took a class that was taught by two practicing physicians who were just also teaching a class. And so in addition to taking that course, I was then able to just email them and reach out and be like, hey, I'm interested in coming in to see what you guys do in the hospital. Would that work? And they were fine with it. Another note on the hospitals is just that logistically, it's also really easy to get to the hospital. Brown has a shuttle system that will take you directly from our main campus to downtown where the hospitals are. And in addition to that, if those shuttles don't work for you, Brown students are also able to use public transportation for free. And so there are also Rhode Island buses that will go directly from Brown's campus to the hospitals. And of course, while we're talking about being pre-med at Brown, I feel like there's no way I couldn't also mention our pre-med advising office in general. If you Google Health Careers Advising Brown, the first link will take you to the page that has all the information that the pre-med advisors give to students who are at Brown and who are pre-med. So if you're interested in learning more, I would definitely recommend that you check out that website, while also keeping in mind that you don't want to get too lost in the nitty-gritty, just because the website does have a lot of FAQs answering specific questions about courses and registration for different things at Brown that maybe would be overwhelming if you're not already a student, already kind of integrated into our specific class lingo and things like that. I know from my own experience, the advisors are pretty accessible. What they usually do is just run office hours a couple of times a week, and so you just drop in during those hours and you can ask the advisors any questions. We also have peer advisors who are older students who are available to answer any questions that students might have, especially if you're just getting started with pre-med, on how to navigate specific courses, which professors are good, what different clubs and activities you might want to get involved with, and so they're also always a really great resource for students. Finally, something else that I want to mention that might be of interest to you if you're pretty sure that you're interested in pursuing medicine is Brown's BSMD program, which is the Program in Liberal Medical Education, aka PLME. I'm just going to refer to it as the PLME program. So basically what the PLME program is that students are able to apply to Brown and also apply to this specific program where if you get in, you're accepted both to Brown and to Brown's medical school. This is a really great program if you're certain that you want to go into medicine, because some of your additional essays will be questions about why it is that you're applying to this program, why you know that you want to be a physician. But what's really cool about the program is that because you're already accepted into Brown's medical school, your requirements look a little different. So for example, you don't have to take all of the pre-med requirements that the traditional pre-med student at Brown would take, because you're able to just specifically tailor those classes to the Brown Medical School requirements. So for example, a traditional pre-med student at Brown will end up taking 2 semesters of organic chemistry, whereas students in the PLME program only need to take the first semester. I think another really big benefit of the PLME program is that you don't need to take the MCAT. The MCAT is a really big standardized test that pre-med students traditionally will have to take in order to apply for medical school. And when I say that it's a really big exam, I mean that it's something that students will study for months for. I know I took it at the end of the summer and I studied for 3 months just to take the exam. It's 7 or 8 hours and is a really, really big time commitment. So I'm not in the PLME program, but I would definitely recommend that if you're pretty certain that you want to go into medicine, that you look into it and look into applying. I will say that as far as admissions go, it's possible to be admitted to Brown and then not be admitted to the PLME program. And also, a question that I get a lot about PLME is that students are able to end up dropping from PLME. So for example, if you go to Brown and you decide that you don't actually want to pursue a career in medicine, that's totally fine. It's not like if you come to Brown and then decide not to participate in PLME that you get kicked out of Brown. The specifics of how the advising goes, if you do make that decision, I'm not super sure because I'm not in the program, but rest assured you are able to continue going to Brown even if you decide you don't also want to go to medical school ultimately. The caveat there is that students who are accepted into PLME aren't also able to apply to other medical schools. So if you get into the PLME program and you accept your spot, you're not allowed to apply to other medical schools unless you rescind your spot at Brown's medical school. So if you're in PLME and you decide you want to apply to other schools, then you also have to reapply to Brown and try to get into Brown as well. So that's sort of the trade-off of being in this early acceptance program, is that you commit to going to Brown, essentially, for medical school. So that being said, you definitely don't have to know right off the bat that you want to be pre-med. Like I mentioned, I'm not in PLME. I came into Brown in my first semester not interested in doing pre-med, actually. I took the chemistry courses because my thinking was, okay, the chemistry sequence is a pretty big part of your schedule if you're pre-med, so I'll go ahead and take them just to get them out of the way in case I change my mind, but I really wasn't interested in pursuing pre-med initially. What really did it for me was actually being able to take courses in some other areas and realizing that I kind of missed doing the biology and doing the science. And I actually also took a course that was taught by two practicing physicians where they talked a lot about emergency medicine and how they connect with patients, and they just talked a lot about their experiences and their stories. That really convinced me that medicine was something that I thought I'd be good at doing and also that I was interested in doing. I think my final piece of advice as far as being in pre-med at Brown goes is just because of the open curriculum and having so many options of what you can take, and then also having this sort of regimented set of pre-med requirements that you need to make sure that you get done. My big suggestion is to make some kind of course planning spreadsheet, or just some kind of, however you plan best, some kind of list to make sure that you can see that you're getting your course requirements done for your pre-med requirements, for your concentration, and then so you can still see how much space you have left in your schedule for the other classes that you're interested in taking. I know for some people, making an actual 4-year plan where you lay out all of your classes that you're going to take each semester is overwhelming and stressful, but I think for me, it's really empowering just to know how much time I have left and where I can fit my courses in order to be sure that I'm getting exactly what I want out of my time in college. So I'm not saying that you need to make a super detailed list of exactly what you're going to study and exactly what classes you're going to take every semester, but I do think it's important that you stay organized and stay on top of the classes that you still need to take for your concentration, especially as a pre-med, because you have those additional requirements that you need to pay attention to. And so, in conclusion, in my opinion, I really do think that Brown is a great place to be pre-med. I think that the open curriculum is a really huge asset to help balance out the sort of rigid structure of the pre-med requirement courses that you need to take. I think having the open curriculum is really nice to have some more flexibility to be able to explore other areas of interest and to be able to really think about what it is that you're interested in before necessarily committing to being a pre-med student or committing to being a specific biology concentrator and doing all those pre-med classes. Additionally, I think that the culture at Brown really is super collaborative, which I know for me was super important because I didn't want to feel like I was competing with my classmates. And I think that being able to learn from each other is a really huge benefit as far as just the overall learning experience of college as well. And I think the fact that Brown is so integrated into the research and hospital institutions here in Providence is a really huge asset just as far as being able to get involved as an undergraduate student. I hope that this was helpful if you're considering Brown or considering pre-med. There's a lot more to say on the topic, but I hope this was a useful overview of what it's like to be a pre-med student here and a little bit of what it's like to be a student at Brown in general. Thanks so much for watching, and I really hope this was helpful.